To the health alert now this holiday season, especially for families with young kids. RSV cases are surging.
We almost lost our daughter to it. We were first-time parents and we weren't sure what we were dealing with.
The kids in the Fisher family have been sick with RSV. The most recent data shows the week of November 6th, 1,200 people tested positive, a number going up weekly. And tonight, Ashley Holden goes beyond the numbers, talking with parents and doctors about this spike.
I kind of figured that he was going to get it. I just didn't think it was going to be this quick.
Alicia and Adam Fisher's son, Atlas, was born premature. Days after being released from the NICU, he ended up right back in the hospital with RSV.
He got admitted to Phoenix Children's Hospital from Mercy Gilbert, and we were there for about 5 days. It was terrible. It's hard to see such a small baby attached to oxygen.
This isn't the Fishers' first time dealing with RSV.
We watched our daughter have it 3 times, 3 years in a row, and she was on oxygen every time.
Their daughter Addison, also born premature, catching the virus the first time days after she left the hospital. So with their son, the Fishers tried to be careful.
But I forgot to protect myself. I ended up getting sick, and then subsequently the baby ended up getting sick.
Atlas, just 1 month old, was thankfully released last Friday. His case, one of the over 3,900 here in the state this season. For the last 6 weeks, those numbers climbing, most in Maricopa County. The latest show 861 cases in 1 week. That's nearly 7 times the cases we saw in the same week last year.
The addition to this is that influenza numbers are also started to go up over the last couple weeks. So we're seeing that, and COVID-19 is also going up again.
Dr. Wasim Balan with Phoenix Children says they still have capacity for those who need to be hospitalized. Other hospitals across the state feeling the strain. TMC Healthcare in Tucson saying they are taking swift and active measures to expand capacity and staffing. With Thanksgiving 3 days away,
I think we need to go back to who are the most vulnerable.
That includes kids under 2, especially those less than 6 months, and those born premature or with pre-existing conditions.
They probably need to, as much as possible, avoid, kind of big groups of people where someone might be carrying the virus and pass it on to the newborn.
The Fisher family's advice?
Don't be afraid to put boundaries in place between your babies and your family. Don't feel bad if you're going to make the decision not to go spend the holidays with family this year, because the numbers are really high.
In Phoenix, Ashley Holden, ABC15 Arizona.
Yeah, do not feel bad at all. It's about protecting your kids. And while there's a lot of focus on young kids getting RSV, it can also be dangerous for many adults. The CDC says every year 177,000 adults are hospitalized for RSV. Groups at higher risk include those with weakened immune systems, heart and lung disease, or anyone 65 and older. For most adults and older children, the symptoms are mild, but keep in mind, though, just because your case is mild doesn't mean it's any less contagious.